got a strong family history, it is worth having yourself checked out or screened. Sometimes patients actually dismiss subtle early symptoms. So coronary disease in somebody with a family history, the kind of symptoms to look for would be perhaps, mild or encroaching breathlessness, which we kind of dismiss on a day-to-day basis. That could be signs of early trouble. Obviously, symptoms of chest discomfort with activity is a concern. But even in the asymptomatic patient, if you've got a strong family history, there is a rationale to having screening carried out. And there are targeted tests that one can think about. There are blood tests checking one's cholesterol or blood fat levels. There are more nuanced blood tests looking for particular fats, such as lipoprotein A, which have been shown that the increased levels correlate strongly with the possibility of underlying coronary disease. We would also check for undiagnosed diabetes, such as checking the blood sugar and other markers of diabetes. Beyond blood tests, there are also other investigations that are helpful. There are an ECG or a stress test of the heart of some sort is useful, and there are a variety of different stress tests, but even a simple treadmill test is highly effective at picking up signs of coronary disease. And now we have access to CT scans, and CT scans are a non-invasive anatomical way of actually looking at the arteries of the heart. So if on the initial screening blood tests there were some signals of concern, we have now a much lower threshold for proceeding to a CT. The CT technology has really evolved, so the radiation dose is very small. The CTs are very rapid, involve only a small volume of contrast, and the imaging that we get are of such high quality that you can, with confidence, either reassure the patient if the CT is clear, or if there is something, we can then pursue that. And so CT really has become the almost investigation of choice in terms of the next step in the screening process. So we would normally start with simple things like blood tests, an ECG or a stress test, and then move on to a CT if there is a rationale for that or a need for that.